Dancing, Hi everyone, thank you for joining our webinar today on Tuesday night. I hope you have already taken your dinners. Anyways, in conjunction with Diabetes Awareness Month and World Diabetes Day on the 14th of November 2021, today will be our first episode of John Kurang webinar, a less sugar adventure. As you have probably heard, John Kurang basically means let's live a healthier life with less sugar. So we do hope that the webinars we will be having this month will be a fruitful one for all of you. For today's webinar, we will have 3 sessions with 3 different experts, which will be sharing with us on the topic of common diabetes diet, myth and facts, dry skin relief for diabetes patients, and goodbye painful glucose monitoring. So if you have any question later during the sessions, just key in your question in the Q&A box and expert will answer them during the Q&A sessions. So in this webinar, you might need to learn how to use these 2 icons. So let me explain these 2 icons for you. The first one will be the Q&A icon. This one is for you to ask questions. And the second one, the chat icon, this one is for you like to participate in the giveaway, or you got any technical issue, you can type it in there. So our team will help you. So let me teach you how to use the Q&A icon. So at first, you need to click on the Q&A icons, then click ask questions. Then after that, type your questions, then you send it. Okay, so the system actually will capture the questions. So just wait for the Q&A session. The expert will explain the question for you. So how to send the chat? So you need to click the chat icon, then you type your message, then you press send. Then the system will capture the message. So, and also good news for you guys. Today we are having a lot of giveaways, many prizes to be won. So make sure you stay with us throughout the whole webinar. You wouldn't want to miss your chance. Let you know first, we are having 4 giveaways. So there will be a giveaway for each session, and we will have one John Kurang giveaway right after the last session. So pay attention, guys. So all attendees actually also can get 500 Caring or Georgetown Wellin points. A link will be given at the end of the webinar. So stay tuned. All right, let's start our first session of the day with NFA. So this session, we are going to talk about the common diabetes diet myth and facts. Searching in the internet for the reliable information about the best diet for diabetes may leave you feel confused. While there is no shortage of advice, it's often challenging to distinguish facts from fiction. Today, we are honored to invite Mr. Kelvin Lin as the speaker for this session. Mr. Lin is a pharmacist with a master in diabetic care and has 16 years of experience being a pharmacist. So if you have any question about diabetes, just key in your questions in the Q&A box, and Mr. Lin will answer them during the Q&A sessions. Also, we will be having a giveaway from NFF 2 later. So stay tuned till the end of our session to answer the giveaway questions. Let's welcome Mr. Kelvin Lin. Hello.
Hi, hello.
Hello, Mr. Kelvin Lim. So this session, there will be 2 Kelvin speaking.
Yep.
So
you're the young one, I'm the older one.
Both also very young.
Yep.
Okay, how are you?
I'm okay, I'm good.
Okay, cool. From your 16 years of experience, what is the most common food-related myth that customer or patient will rise up?
Okay, I'm not sure if it's the most common myth, but I think the one that I can remember the most is the one where customers like to buy diabetic formulas and they give to their parents when their parents overeat instead of using it as a meal replacement. So meal replacements all diabetic formulas are supposed to help a diabetic to reduce their blood sugars by replacing other kinds of food, not trying to bring the sugars down after you eat something too much. So whenever you buy meal replacements like insulin, do bear in mind that this is the fact, and our pharmacists need to play a role when they sell these items.
Yeah, this is very important for the public educations. So maybe I will pass this session to you now for your sharing.
Okay.
Okay.
All right, I will try to start my screen. Can you see my slides?
Yes, Mr. Calvin.
Okay. Hi, good evening, everyone, and thank you for the introduction by the MC. Today, I will be talking about common diabetes myths and facts, and these are compiled from the common beliefs and misbeliefs of public health. So let's take a look at the first common belief. If I cut out sugar from my diet, I will not get type 2 diabetes. Many people link diabetes directly with sugar, and I'm sure you have heard someone say, I only eat sugar-free food. I don't want to get diabetes. Is this a myth or a fact? Well, unfortunately, this is a myth. Sugar does not directly give you diabetes. Many risk factors have been identified as major contributors to type 2 diabetes, and among them, obesity or being overweight is the number one risk factor. Our genes play a role too, and so does leading a sedentary lifestyle. The less you exercise, the more likely you will end up with diabetes. Age is another factor, among others. It might surprise you that taking sugar is not currently recognized as a direct risk factor for diabetes, and this is why. Sugar is not the only food that can cause obesity. In fact, taking in any food in excessive amounts can make you fat. If you control the amount and frequency of eating sugary food and control your diet to a healthy portion, sugar is actually okay for most non-diabetics. So am I telling you that eating sugar or sweet food is not the cause for diabetes? In simple terms, yes. In fact, even if you eat nothing sweet at all, like kway teow soup for every meal, you are still at risk for developing diabetes if you overeat. Overeating causes diabetes. The key to prevent diabetes is to eat in the appropriate portions and lead an active lifestyle. Sugar, when used in moderation, does not turn a healthy individual into a diabetic. However, sugar in excessive amounts can burden your pancreas. Our pancreas is the organ that produces insulin, the hormone that gets the sugars in our blood into our cells, so that they can use sugar to produce energy. If you eat large amounts of sugar or eat sugary food very frequently, your pancreas is forced to work much harder to produce more and more insulin. And a tired pancreas can ultimately lead to type 2 diabetes. So the take-home message here is, sugar in moderation is okay for non-diabetics. And now for the next common belief. Well, I do have another group of patients asking me, eating sugar, is it okay for a diabetic? It's not, right? Well, they're right. Sugar behaves differently in diabetics. Just moments ago, I said sugar is okay for most people if you take it in moderation. But it's not so okay in diabetics, especially if you have uncontrolled diabetes. Let's take a look at what happens to blood sugars of a diabetic versus the non-diabetic when they both drink a can of Coca-Cola. The blue box represents the blood sugar levels of non-diabetics, while the red box represents the sugar levels of a diabetic when they both consume a standard can of Coca-Cola, which contains about 39 grams of sugar. In a non-diabetic, the blood sugar rises up fast, but it also comes down fast. Whereas in a diabetic, sugar not only rises fast, but rises to a much higher level. It also stays high for a very long time. Why the big difference? In non-diabetics, our pancreas releases insulin even before sugar is absorbed into our bloodstream. This is what we call the incretin effect. This head start keeps blood sugars low, and even if it rises, this lightning-quick insulin release brings sugars down fast. Insulin, however, is released slowly in diabetics. This is because the pancreas of a diabetic is unable to produce enough insulin nor fast enough to get blood sugar into the cells. so the blood sugar stays high in the blood for a much longer time. We call this phenomenon the blunting of the incretin effect. The higher sugar level and longer duration it stays high is what damages our tiny vessels and in turn our organs. This is what causes some of the complications of diabetes, such as blindness and amputations. Therefore, limiting total daily intake of sugar to 2 tablespoons per day is recommended for diabetics with reasonably good control. Do take note that this 30-gram allowance includes sugar hidden in food products. If you are not well controlled though, sugar intake should be limited to 10 grams per day. If you find this hard to achieve for you, consider using sugar replacements like sucralose and lakanto in your meals in place of sugars. Opt for lower glycemic index food for better sugar control. Some might be wondering what I mean by glycemic index. Glycemic index refers to a number between 0 to 100 assigned to different kinds of food based on their ability and speed in raising our blood sugar. The faster something raises our blood sugar, the higher the number. For example, glucose has a glycemic index number of 100, whereas our table sugar sucrose has a slightly lower value of 66, which is still high, by the way, because any number above 50 is considered high. Let's take a look at how different glycemic index foods affect the blood sugar levels of a non-diabetic individual. Please do take note that the graphs here are for illustration purposes only and not actual data. When a person takes high glycemic index food, in this example, a can of Coca-Cola, we see the blood sugars rise and fall quickly. This is because our pancreas goes into sprint mode and releases a robust amount of insulin at lightning speed. You can think of it as Usain Bolt running his 100-meter sprint. When we consume a lower glycemic index food, like a piece of wholemeal bread, however, the sugar takes a longer time to be digested and absorbed in our gut, therefore enters our bloodstream at a much slower rate. So blood sugar levels don't rise up that much, but persist for a longer duration, kind of like Kipchoge doing his marathon run. Okay? But when we take a look at the diabetic sugar profile, some differences are observed. Low glycemic index food gives rise to a similar pattern to that of a non-diabetic because the pancreas can still keep up with the slower rate of absorption of sugar in the gut. But if you give them high glycemic index food, the pancreas is unable to cope with the sudden rise of sugar and hence allowing the sugar to go up beyond the normal limit. We can imagine the pancreas of a diabetic as an old man. Okay? Jogging slowly is still acceptable for him, but if you ask him to sprint, he's incapable of doing so. Keep in mind that fatty food don't tend to raise your blood sugars that much, so technically they are low GI too. But taking excessive fatty food will make you fat, hence also increasing your risk of getting diabetes. So remember to limit your fat intake too. So the take-home message here is, kurangkan manis, choose lower glycemic index, low-fat food. Oh, by the way, there are Coca-Colas out there without sugar, so you can still enjoy your favorite drink without worrying about rising blood sugar levels. And now for the next common belief. Okay, this is a popular one. Sugar from fruits are natural, therefore safe for diabetics. Is this a myth or a fact? This is a myth, unfortunately. Although the sugars in fruits are all natural, fruits still contain simple sugars like fructose, sucrose, and glucose. The content of sugars also vary between types of fruits, the stages of ripeness, and the method of preparation. An example here is green apples versus apple juice. A green apple will have lower glycemic index, whereas red apple juice will have higher glycemic index. This is attributed to the different stage of ripeness, and more importantly, the breakdown of the cell walls during juice preparation. Therefore, we need to limit the portions of fruits we take as well, especially for diabetics. As a general rule of thumb, we need to take about 1 to 2 servings of fruits per day. We need to also be aware of the dried fruits. When we talk about portion sizes, we are referring to fresh fruit. Fruits, when dried, take up much less volume, and we tend to end up eating much more than we intended to. Examples of dried fruits are raisins and dried apricots. This can get us in trouble as the dried fruits are much more calorie dense than fresh fruit. So the take-home message is, fruits are good, but eat it right. Pay attention to portion sizes and the method of preparation. And now we move on to the next one. So this is a rather recent belief where some of my patients ask if we can actually cure diabetes by losing weight. Is this a myth or a fact? It might surprise some people, but it's mostly fact. You can experience remission by losing weight. In a big trial called the DIRECT trial, they did in fact see about 40% of trial participants who lost more than 15 kilograms of body weight going into remission. Remission can be considered the closest thing to a cure where you do not need medication to keep your blood sugars in range. To aid in losing weight, the participants in this trial only drank a form of meal replacement for the first phase and nothing else. Meal replacements are designed to have an ideal balance of food groups in a ready-to-drink formulation. However, not everybody in the trial achieved remission, and the trial is still ongoing, so we do not know how long this cure can last. But even if you do not achieve full remission, you still get a lot of benefits in terms of blood glucose control and prevention or improvement of other metabolic diseases like blood pressure reductions if you lose weight. A healthy rate of weight loss would be around 2 kilograms per month or about half a kilogram per week. Now, this is an example, If the person initially weighs 80 kilograms and his target weight is about 65 kilograms, he's supposed to lose about 2 kilograms per month. If he sticks to this 2 kilograms per month, he can reach his target in 8 months. A healthy rate of weight loss should be around 10% in 6 months. Now, I know that there are many, many ways to lose weight, but of all these many ways, they all fall into these two categories. The first category is to reduce calorie intake. We can use meal replacements like the ones used in the trial. We can reduce portion sizes, or we can even use the very simple plate method advocated by our government. The next category will be to increase output or to burn the calories away. And of course, this will involve exercise and more physical activity. As long as your output is more than your input, you will lose weight. And interestingly, standing can help reduce weight and blood glucose. We're serious, not joking here. How do we know? Let's take a look at the 2020 meta-analysis by Mayo Clinic. A meta-analysis is just a name for a type of high-level analysis or research paper. What does it say? Well, they looked at 3,000 over subjects, and those who stood more for about 1.3 hours per day had more weight loss and better sugar profile than those who sat more. How much weight did they lose just by standing more? About 0.6 to 0.9 over about 3 to 4 months. I know that's not a very big number, but imagine that. Standing and doing nothing can make you lose weight. So let's imagine this being your new office setup. Have you noticed there are no chairs there? Or this, there are chairs, but the office is designed for people to stand most of the time. By making their employees stand more, this company aimed to improve the general health and productivity of their staff. Perhaps there's something we can learn from them. The take-home message here is to lose weight, eat less, exercise more. And now we move on to the last common belief. This next belief comes from diabetics who took the advice from doctors and pharmacists to start exercising regularly. They believe that they must eat something before every jogging session if they're a diabetic. Is this a myth or a fact? Well, it depends. To give this belief some credit, hypoglycemia is a very dangerous aspect of exercise. Most people with diabetes will be on medication, and these meds very often suppresses our liver's ability to pour out sugar. So if you happen to have low blood sugars during exercise, the liver cannot release emergency stores of sugar to normalize it. We have been telling our patients that you need about 150 to 170 minutes of medium intensity exercise per week to help keep your blood sugars in check. And a popular choice for medium intensity workout will be jogging for many. When we jog for about 20 to 30 minutes, we use up the sugar stores in our muscles, and we'll need our livers to start the process of gluconeogenesis, which means to generate sugar from non-carbohydrate stores. So at about the 30-minute point, diabetics tend to be vulnerable to hypoglycemia or low blood sugar. Hypoglycemia should be avoided as much as we can. So how should a person with diabetes start jogging? The first thing you need to do is to check the blood sugars. If your blood sugar level is below 7 millimoles per liter, eat something small. For instance, a banana or a slice of bread before you jog. If your blood sugar levels is around 7 to 12 millimoles, you're good to jog without snacking. If your blood sugar levels are above 12, it's best if you check for ketones, because if you have ketosis, you are not recommended to jog. Please bear in mind that these numbers only act as general guidance. Everybody's body might react differently, and it's important for you to know your body well before you jog for longer distances. If you are on insulin treatment, talk to your doctor to see if you need to reduce your dosage before you jog. Another important tip for diabetics during their jog is to bring along a buddy. This buddy has to know your condition and knows how to give you treatment if you develop hypo during a hike or a jog. If he or she doesn't know how to treat hypoglycemia, bring him or her to the pharmacy for a session of training. This is perhaps the most important exercise tip here: bring along a buddy. If you jog for a long period of time, you will need to eat high glycemic index carbohydrates at a rate of about 0.5 to 1 gram per kilogram per hour. To make it simple, for a person weighing 60 kilograms, this person will need to eat about 1 to 2 bananas every hour they continue jogging. Or if you prefer to use power gels, you will need about 1 to 2 packets of Hollis Repase gel every hour. Also, don't forget to stay hydrated. When you first start jogging, you need to check your blood glucose every 30 minutes. I know it's a hassle, but this will help you know your body better. Blood checking frequency may be reduced once you have got the pattern. Continuous glucose monitoring, a new generation of glucose monitoring device, would be the best here, as it can read your blood glucose levels even as you jog. Continuous glucose monitoring, or CGM, is able to measure your blood glucose readings in real time, and some of the brands can send it to your phones every 5 minutes or so. So most of the personal CGM systems currently available in the market provide high and low blood glucose alerts that helps the patient to detect hypo or hyperglycemic events, which can reduce the episodes of hypoglycemia. Do take note, this is very brand specific and not all brands do this. And having this as your training partner will help prevent exercise-related issues. If you take a look at the picture on the right, you might see some small colorful rectangles there, right? These are basically small sensors you stick on your skin, and the sensor has a tiny probe that measures your blood glucose 24/7. Okay. For the last piece of advice, if you do develop any low blood sugar episodes, do not exercise within the next 24 hours, especially if the hypoglycemic episode was a serious one. This is because your body might not pick up these symptoms of hypoglycemia, for instance, trembling hands, palpitations, as you usually would. You will be at risk of having low blood sugars even without knowing it. This phenomenon above is what we call antecedent hypoglycemia. So the take-home message here is, Monitor your blood sugars well, know your body, and bring a buddy. That's all from me. So I'm open to questions.
All right, thank you, Mr. Lim, for the insightful sharing. I really like your presentations. Your slide is very nice, and the accent is very, very nice. I like it a lot. Okay, so let me know in the comment section if you enjoy the sharing. Just type yes or I like the sharing like that. So yes, from the summary for the Mr. Lim's sharing, we know that we can eat fruits, but the portions is the key, and we also need to see how the preparations. If the dry fruit is normally more in volume, so you tend out to tap more. And we also know that the sugar is not the direct risk factor for the diabetics. So, all right, before we start with our sessions, Q&A sessions, I'm sure a lot of you are waiting for the giveaway. This question is very easy if you have listened to Mr. Lim just now. So, answer this question. Sugar is not a direct risk factor for diabetes. True or false? In the chat box, we will select 3 winners with the most accurate answer randomly to win a NFA, Insulin Complete Nutrition at 150 grams after the sessions. Do remember to like our Caring Fast Food page because we will posting the winners announcement there next week. So, all right, let's go to the Q&A sessions. We have received a lot of questions from our audience for Mr. Lim to answer. So our first question goes to Miss Xing Yi Ku. If added to Coke, any healthy substitute or solutions?
Okay, you mean Coca-Cola, right? Not the other Coke, right? Okay, so okay, if you're addicted to Coca-Cola, the best way for you to switch or to become healthier, I think, would be to switch to the zero-calorie Coca-Cola. But you must understand that the end point would be for you to actually get rid of this addiction, and you need to set a realistic goal for you to achieve that. Okay, for the time being, yes, you can switch to those sugar-free, calorie-free Coca-Cola, but try your best to reduce it gradually so that one day you are not addicted to Coke. Because if you are addicted to Coke, it might mean that you're addicted to other sweet things as well. So this will make life harder for a diabetic.
Okay, thank you for the explanation. So we're going to the second questions from Nyo May. Sugar replacement safe? Like Lacando, Stevia.
All right. Well, sugar replacements are generally considered safe. Yes, they are. Okay, especially when you don't use it in excessive amounts. Sugar replacements are actually a very viable way for a diabetic to try and get used to low-calorie diets gradually. Because if you ask me to stop taking 100% no sugar, I would find it quite hard as well. If you are still slightly worried, there are a lot of natural forms of sugar replacements, for instance, like Canto and even things like stevia. So you can opt for that if you are a bit more paranoid, I would say.
Okay, thank you, Mr. Kelvin. So another question is from Miss Jasmine Liu. May I know, is it safe to consume honey? We know that the honey is good to help, but honey also very sweet. So this audience is concerned about the sugar intake.
Right. So just like fruits, honey is natural, but just like fruits, honey does contain quite a high amount of sugar as well. Compared to glucose, honey has a lower glycemic index, but it is still considered a high sugar food for a diabetic to consume regularly. So if you are well controlled, you can still stick to the 30 grams of sugar allowance we would have. But if not, I would prefer you try to limit your honey intake to probably about 1 teaspoon per day.
Okay, cool. So 1 teaspoon is around 15 grams?
1 teaspoon is about 5 grams. So because she probably will be taking some kind of other food as well. So the limitation would be there lah. Just bear in mind that if you want to take honey, you need to cut down other forms of sweet food and monitor your sugar as well to make sure that you are okay.
Okay. So for the next question is taking brown sugar okay from Maureen Lam.
Okay, brown sugar is actually less refined than sucrose. So it might have, I'm not very sure about this actually, it might have a lower glycemic index, but in reality, it's not really a better choice considering brown sugar still has high glycemic index. So even if you use brown sugar, you need to limit your sugar intake if you are a diabetic.
Okay, so I think due to the time constraints, so there is a lot of questions. Maybe later the pharmacist will answer them, then they will send in the captions or chat box. So thank you, Mr. Kelvin, for the sharings. Okay, I think that is end of our sharing session. So before we end our session, Mr. Lin, do you have any tips or key takeaways you want to share with our audience before end of sessions?
I think that the key takeaway I noticed is that we need to understand that portion sizes is very important. And if you guys don't really know your what's the right portion to take, make an appointment with your dietitian and they will give you a very, very good guide on what the good portion sizes are.
Okay, thank you, Mr. Kelvin. Yeah. Okay, I really enjoy your session. Bye-bye. See you again. Okay, that is end of our first session. So thank you, Mr. Kelvin, for sharing all the diabetes myths and facts. Next up, we are going to talk about dry skin relief for diabetic patients. We all know that diabetes can affect many parts of your body, including your skin. Actually, dry itchy skin is one of the common symptoms that diabetic patients have, but what causes it and how we can prevent or manage it. Without further ado, we are honored to invite Dr. Tan Lan Lan as the speaker for these sessions. Dr. Tan is a consultant dermatologist and general physician at Thomson Hospital, Kotak Damansara. She has 21 years of clinical experience and specializes in assessing and treating a wide variety of skin diseases such as psoriasis, eczema, acne, cysts, and many others. So if you have any questions about dry skin or diabetic skincare, just key in your question in the Q&A box and Dr. Tan will answer them during the Q&A sessions. Also, we will be having a giveaway from Userin too. So stay tuned till the end of the sessions to answer the giveaway questions like just now. Okay, let's welcome Dr. Tan Lan Lan. Hello.
Hi, yeah, I'm very happy to be invited to join this session. Okay. Yeah, so how's everybody?
I'm fine. How about you, doctor?
I'm good. Okay.
Yeah,
taken my dinner. Yes. Okay.
So before we pass the stage to you, just asking out of curiosity, Dr. Tan, do you think diabetic patients commonly experience dry skin concerns based on your 21 years of experience?
Yes, definitely. Yes, diabetes, not only diabetes, but in fact, elderly. So have high prevalence, meaning that a high percentage of people, when they are getting older, their skin will get drier. And of course, when you have diabetes, which is also a very common condition in our country, not only in our country, but later I'm going to share with you, how common is diabetes in our country and how common is dry skin in our country.
Okay, so
it's a very disturbing disorders that can affect their daily activities, their itch, day and night.
Okay, I truly understand. So maybe, doctor, I will pass this session to you now for your sharing.
Sure.
Okay.
Share the screen. I'm sharing the screen. Okay.
So now we are waiting for our doctor to share her screen.
Yes. Yeah. Just hold on. All right. Can you see?
Yes, Dr. Tan, I can see it clearly. Okay.
Yeah, all right, okay. So I'm going to start my session. I'm glad that everybody is joining until now. All right, so I'm actually told to talk about dry skin relief for diabetic patients. So before I go into this session, I would like to, look at the how common is diabetes. So how common is diabetes? It's like globally is about 8.5 of the populations, is roughly about 1 in 10, in the populations have diabetes. But let's look at Malaysia, all right? It's about 16.7 in Malaysia according to data for people who are more than 18 years old. And if you do a short calculations, it's equivalent to about 3.6 million. So of our population have diabetes, and it is not a small, population. So it's and on top of that, how common is skin disorder in diabetic? It range about 7.6 to 30%. So it's pretty common. And as we know, diabetes, we have type 1, we have type 2 diabetes. Okay, so surprisingly, in type 1 diabetes, the prevalence of skin disorder is 71%, meaning if you have type 1 diabetes, you're prone to have a dry skin. So, like I just mentioned, how common is dry skin in our general population? Even if you don't have diabetes, when you get older, our skin will get drier. And when you have a dry skin, you will lose your barrier, skin barrier function. So when you lost your skin barrier function, that's where you have all the itch. Okay, because what is our skin function? Our skin actually functions to protect us from bacteria, from virus, okay, and it's actually maintain temperature, okay. So if we have the loss of defective skin barrier, we will feel very cold, and in some people that can even feel chills. And of course, bacteria can easily set in, and not only bacteria, allergens, okay. If you're allergic to the things can easily stick onto your skin, and we will have a vicious cycle of itchiness. So it's really affecting the daily activities, causing you cannot sleep, cannot work, okay. So, and itch is actually sometimes more disturbing than pain. Okay, let's look at what are the skin changes in diabetic. And of course, the commonest changes of diabetes is dry skin. Okay. And when you have dry skin, you're more prone to itching. Of course, when you have a diabetes, and I suppose everyone know that if you have a diabetes, you are more prone to kidney disease. Okay. So if you have a kidney disease, of course, that will affect, your skin dryness. It causes more skin dryness, higher risk of skin dryness, and higher risk of itching. And let's say if you're so unlucky as to go into kidney failure, of course, there are more itchiness. Okay. And of course, if you have diabetes, one of the risk factors is, getting a psoriasis. Psoriasis is actually a long-term skin problem. There's no cure for it, okay? But there's on and off flare, but you can actually control it. Well, on top of dry skin, itchy skin, and psoriasis, we are if you have diabetes, our immune system is lower and you are more prone to infection. For example, fungal infection, candidiasis, tinea, there are various types of fungal infection, and of course, viral infection like herpes zoster, bacteria like impetigo or ecthyma. So there are many types, not limited to these. There are many other types of infection, and there are still a lot of these skin disorders that can occur in diabetes. The list is long, so I'm not going to elaborate on that, but some of it, can be associated with diabetes. Is very common, like a skin tag or acanthosis nigricans. In some diabetes, in some patients, they certainly found that they have darkening on the skin, on the neck, and on the armpits area. And why is it so? They're not, they're not sure why is it. So one of the cause is diabetes. Okay, so there's a study which shows that how common, what is the frequency of skin disorder in diabetes? So of course, cirrhosis. What do you mean by cirrhosis? Cirrhosis is actually a dry skin. So it's the commonest. It can be up to 75% of people who have diabetes will have dry skin. And of course, if you have dry skin, you will have itchiness, and you can have diabetic dermopathy. You can have a finger peppers and or a thickened skin. So if you suddenly notice your skin become thickened, so you will probably need to be aware that you probably have diabetes. All right. So cirrhosis, this is just to recap, cirrhosis means dry skin, and it occurs up to 75% of diabetes. It is very common. And the photo on my right side is actually a photo showing dry skin, a very dry skin. If you look at the skin, this is what we call ichthyrosis. So what is ichthyrosis? Okay, so meaning that it's a fish scale, okay, in Greek. So your skin become very dry until it looks like a fish scale. Okay, cirrhosis is actually, or dry skin is actually a warning sign of your blood sugar level is high. So if you suddenly have a dry skin, you suddenly have itchiness, you may even want to check your sugar and see whether you have diabetes or not. Okay, so this is one of my patient who actually very itchy skin. If you look at the skin, so it's cracked. Okay, it's like a river bed, so it's cracked until it is painful. Whenever even touching water is very painful for her. So when you look at that, the skin is actually very dry. So it's a condition called eczema querulae, and it is actually caused by hormone problem. Another hormone problem is what we call a lack of thyroid. Okay, so thyroid is actually a gland that produce thyroid hormone on your neck. Okay, if you lack of that, we call that hypothyroidism, and that can lead to a very severely dry skin. So the patient has undergone treatment. We treat it to reduce inflammation and the skin, and after 1 week she's better. At least you can see that it's like itchy, and all the redness actually turn a bit to the darkness, while the cracked skin actually repair by themselves. All right, it become actually this so they have formation of a good skin on top of that. All right, so what are the causes of a dry skin other than diabetes that we mentioned? Old age is another cause of dry skin when you're more than 65 years old. And if dry skin occur when you are kids, when you are young, okay, of course it can be congenital, it can be related to genetic. And of course, eczema, if you know that eczema is a very common group, but it is not as simple, it's very complicated. It can be, complicated by infection as well. And if you have eczema, which is a very itchy skin, then you are actually prone to dry skin for lifelong. And with that, you need to, apply moisturizer, appropriate moisturizer for the dry skin for life. Okay, and of course when you get older or you get diabetes, then even you can even apply more moisturizer, and you need to treat the eczema appropriately. And of course when you get post-menopause, so you have a dry skin, you have an underactive thyroid, like just now I mentioned, you will have a dry skin. If you have a kidney disease, okay, you will have a dry skin. And other risk factor for dry skin is cancer. All right, so if you have a blood cancer like a lymphoma, so which you often heard of, it is a cancer of the blood, you might have dry skin. And of course, if you have a malnutrition, lack of nutrition, and blood loss, you have also a dry skin. And there is other skin disorder, chronic skin disorders like a psoriasis. You might have a dry skin as well. And the psoriasis is actually a very thick, scaly condition that you need a lot of moisturizer to moisturize back the over, proliferation of the skin. And there is a condition called acrodermatitis enteropathica, which is also condition in which it can be congenital or acquired zinc deficiency, which also may cause a lot of dry skin and itchiness. And of course, if you are infected with HIV, you will have a dry skin as well. All right. So when you look at this skin, what does it look like? Okay, it looks like a fish skin, a fish scale. Okay, there are large. Okay, but we call this ectasis. So in Greek, ectasis means fish scales. Okay, so it can be inherited, meaning that you are born with it. You are genetically born with this dry skin. Unfortunately, that's very unlucky. Or you can acquire it. So acquire meaning that suddenly, in a certain stage of your life, it may be 20, 30s, 40s, suddenly you have very dry skin. Then at that, if you have to have a high level, high index of suspicion that what problem you have, why suddenly you have this dry skin. So you must, certainly search for paraneoplastic. Paraneoplastic meaning that it could be caused by something, like cancerous. So let's go on. This is another case. 9-year-old, he suddenly have an eruption of very dry skin. And before that, the skin is very nice, very smooth. Then at the age of 79, well, can it be caused by old age? Yes, it probably can be caused by old age, but it's too sudden. So you see a lot of cracked skin. So you must work out whether it's a kind of paraneoplastic or is it caused by cancer. All right. When after working out, the patient actually has a lymphoma, which is a nodal anaplastic large cell lymphoma. And after treatment, surprisingly, with moisturizer, treatment of keratolytic agent, of course, treatment of the underlying cancer with chemotherapy, patient skin become fine back. All right. So it's not genetically related. It is acquired, and you treat the underlying condition, you replenish back the skin, it can be back to normal. Okay, that's very encouraging. All right, so then let's go back to our main topic in how to manage dry skin in diabetics, or I can add, on the title, elderly. All right, so what is the treatment? Of course, you need to use soap. And when you use soap, you want a low pH, with ceramide. Ceramide is actually something, the ingredient of ceramide is actually our natural moisturizing factor. And you choose a cleanser with no fragrance because you don't want fragrance. Then how about preservative? Preservative sometimes is needed to prevent bacterial infection, but we choose those not easily allergen, okay? So then you need to wash with antiseptic or salt water, especially over the cracked skin. Like I say, our skin actually form a protection, okay, against the bacteria. Once there is a breach of that bacteria virus that tends to invade, okay, so then you need to wash with a bit of antiseptic and salt water, but a gentle antiseptic which is not too irritating to the skin, because when you have eczema, it can be very irritating even with water in some people. All right. Then, of course, after washing already, it could be a bit dry. Okay. So that's why you need to moisturize back, your skin with a lot of creams or emollients. Okay. And the advisable, ingredients, contains in the cream will include urea. And if you have a very thick, dry skin, you want to soften it, you might want something, stronger, which like, we can say that to lyse the very thick keratin, okay, using urea, salicylic acid, alpha hydroxy acids, and replenish the natural moisturizing factor with ceramides. But of course, if you have a suddenly acquired dry skin, sudden eruption, then you have to have a high index of suspicion of underlying disease. For example, whether you have a systemic disorders like hormone problem, whether suddenly you have a cancer, of course, you have to monitor other signs. For example, whether you're losing weight or not, any symptoms, and of course, malnutrition. All right. So why a non-soap cleanser? You must understand, we always say non-soap, meaning that what is the difference between a soap and non-soap? Okay, so a soap basically is higher pH. Okay, non-soap cleanser less higher pH. Why we need that? Because it's a soup contains surfactant, okay, that extract and emulsify the skin surface lipid. So and then so these are the soap, and then if you have the surfactants, it extract your lipid out from your skin. Of course, our skin have a few layers, and then in between the layers there are actually many natural moisturizing factor. So if you extract that out, and then it's cause a defective skin barrier function. All right, so that's why a soup is not good. A surfactant that is one of the ingredient in the soup actually can remove your stratum corneum, which is the first layer of the skin. So if the surfactant bind to the skin protein and it affect the shape and the functions, and then it cause crack in the skin, so there's loss of skin barrier function. So, and of course, second step is to moisturize your skin with emollients. Well, an emollient generally work best. So if you apply to a slightly moist skin, so I would advise on my patient to apply it after bathing, and try to limit the bathing to less than 1 hour, in fact less than 15 minutes. Okay, so you apply the skin after bathing, you just wet it with a clean dry towel and you apply the moisturizer. Well, you use the moisturizer whereby the pH is less than 7. I'm going to tell you why later in my slide, why you need a low pH, okay? And then you have to contain ingredient like humectants, which is also our natural moisturizing factor. So such as urea, propylene glycol, glycerin, alpha hydroxy acid, salicylic acid. Why we need humectants? Because it will increase the water holding capacity of the skin. Then it moisturizes your skin. So of course, if you need, then you probably need to apply medication, topical medication like steroid phobia. I know there's a lot of steroid phobia now, but if it's indicated, you still need to put it, but provided you have to treat the infection as well. And if you want the steroid sparing, effect, you can use topical calcineurin inhibitors to treat the inflammation. Else you'll be scratching it, and it will lead to a vicious cycle, which is the itch scratch cycle. Meaning, the more itchy you are, you scratch it. But however, scratching is not one of the treatment for skin disorders. The more you scratch, what will happen is you damage even more the skin barrier, and you introduce more infection there. So the more infection there, the more itchy you become. And then the more you scratch, and then your nerve will become very thick. And the nerve is the one that causes you to have the itchy sensation. If your nerve have become very thick, it is the most difficult condition to treat. And of course, if you apply, if you when you have a very very dry skin, we not only use cream, we even need to use something which is more oily, to provide an occlusion on the surface. If it is too watery, like if you have a lotion and you apply a lot of lotion, but it evaporates very fast, so you have to use something which is occlusive, like a bit of oily, okay, to prevent the water loss. So you can choose ointment, and recommended for very dry, scaly area is it can be as the amount can be up 250 grams, which is quite a big amount, and you have to use it liberally and regularly. All right, so the moisturizer will form a protection against all the noxious agent, allergens, and prevent water loss. Okay, so the basic principle is that we want to moisturize the skin. We supply a lot of water, a lot of moistures in a form of natural moisturizing factor or humectants. We have to replenish the defective barrier with a lot of lipids, which is also our natural moisturizing factor, and we prevent, the water loss from the skin. Well, of course, if you have dry skin, you have very itchy, cannot sleep, disturb your sleep, and up to 30% of diabetic skin will experience itch. So this is the itch scratch cycle I'm talking about. When you feel itchy, then you scratch more, so your skin will become more sensitized, to itch. So what we call sensitization of your nerve fibers. So if you sensitize it, constantly irritates it, it become more itchy. So it's just a sensation, caused by the nerve. So how to stop it? Very easy, and it's common sense just to stop the itch scratch cycle. But it is not that easy to stop the itch, okay? So, and if you have itch, you cannot stop scratching. So this is the difficult part, okay? So, and also if you went into dialysis, meaning that you need dialysis, so it can occur in up to even, higher frequency, like 42%. And you can see, very itchy condition. So what we need to do is like we need to over cleanse it. In some people, they are a little bit obsessive. They need to cleanse it, frequently, bathe for more than 10 times a day. Especially now in the pandemic era, a lot of people try to wash their hand very frequently. Some even wash for more than 20 times a day. So yeah, because we need to wash our hand, but we need to stop over cleansing it. If you over cleanse your hand, you're going to cause disrupt your skin. So it's going to cause a disruption in the skin barrier. It's going to extract all your natural moisturizing factor. So you will end up with a very dry skin, and the skin may crack. Okay, and avoid excessively hot water while shower. If you use hot water, you temporary relieve the itch, but then after that it will revenge. Okay, so the hot water will cause more dryness afterwards. Well, avoid bathing too frequently and avoid bathing too long. Avoid sun exposure because some itchiness may be precipitated by sun exposure. Avoid swimming because the chlorine or the chemicals, and it has a high pH, so you avoid that to prevent dryness. And bathing is not too long, not too hot. I would say less than 10 minutes. So if you have a excessive water only, water exposure, it will strip away your natural moisturizing factor and sebum. Okay. And what happens if you don't care about it? So these are the consequences. You will have this disorder where it's called nodular prurigosis. It is a very itchy condition whereby you cannot stop the itch. So when you have the itch, you continue to scratch. Actually, this condition is very difficult to treat. So this is called nodular prurigo. All right. So if you get into this, then we have no choice but to use a very super potent, strong corticosteroid. We sometimes need to do it in occlusion, and we need to stop the itch by giving you menthol, hydrate back the skin, by giving you a lot of urea salicylic acid. And sometimes you even use, very invasive things like cryotherapy, phototherapy, oral medication, like we suppress your immune system. You have to go to that. Otherwise, it won't get better. And there's another option you can do is actually what we call intralesional steroid injection. We do small injection into the skin to shrink this area to relieve the itch. Okay, so this is another condition where you scratch. Just now you see small nodules. This patch of skin, this is a bigger patch of skin. This is also caused by eczema. This is also caused by dry skin and habitual scratching. And because as a result of this constant scratching, it becomes this patch which is extremely itchy, and you have to do the same thing. You have to put a super potent steroid and intralesional steroid, lot of emollient like keratolytic, agent to occlude this. Okay, and you have to put a judicious amount of moisturizer. And let's talk a bit about keratolytic agents, urea. What is urea? Urea actually is naturally present in our healthy skin and is one of the 3 natural moisturizing factors in the outer horny layer, which is called the stratum corneum of our skin. So the other 2 is lactic acid and amino acid. So it markedly reduce, of course, in a dry skin condition, you lack of the natural moisturizing factor. That's why in a dry skin, you have lack of urea. All right, the indication for application of these urea includes atopic eczema or psoriasis, ectasis, just now I mentioned, very dry skin, cirrhosis, nodular prurigo, very thick skin, very itchy skin, which is very recalcitrant to treatment, or lichen simplex chronicus. Well, how does urea work? Okay, so it works by moisturizing your skin, of course. It softens the skin and it provides water. So it has a hydrating effect. It's water loving, and of course, it lies a very thick horny layers on the skin so that you get penetrated, can moisturize more effectively. And it of course provide a skin protection. It has a direct protective effect and it helps the skin to regenerate. And it has irritation soothing effect, so it's antipyretic, meaning that it will stop the itch. And it assists penetrations. If you put urea, then the other medication you want to put on top, for example, you want to put cream, antifungal cream, or corticosteroid cream to reduce inflammation, is more easier to penetrate. Well, it's of course available in many forms, including cream, lotions, a shampoo, gel, or in a shower. And of course, the strength of the urea can be as high as 40%. Of course, different area of the skin, you need to apply different strength of urea. It's not that you have to everything, apply very high dose. Then it can also lead to irritation at times. And urea at a concentration of 40%, which is super high dose, is in fact used to do a nail avulsion, meaning that we use it as a medical nail avulsion. We put that slowly, then it will dissolve even the nail. So you can see how invasive, how strong is urea 40%. All right. Of course, it's the external usage only. You cannot eat it. Okay. Avoid the contact with the eyes, which is your mucosa surface. And of course, you don't want to use on the cracked or bleeding skin because it might irritate the area. And you don't purposefully use it on the lips, inside your mouth or nose or the vagina area. So, what are the side effects of urea preparation? Of course, in this world, there's no 100% no side effect. So, because there's no 100% in this world. Well, but urea is in general quite well tolerated. Well, the side effect the most is causing mouth stinging, itchy, and most of them do not require any medical attention. But there are several studies shows that urea at the 10% dose is actually act as a moisturizer. If it's more than 10%, it's act as a keratolytic agent. So basically, it softens the skin. All right. So in some people, we might need to occlude it so that the action of the moisturizer, can be even stronger. It can be even more effective. All right. So then, of course, some people may have a very cracked skin. This is a crack heel, which is very common. And you can actually soften it with the urea, or you can put salicylic acid. But of course, you need to treat the crack area, like I just mentioned, with antiseptic or even salt water is a very good choice. All right, just some study, this is probably my last slide. Okay, pH is a central regulator of a skin barrier homeostasis in one study done by the Korean. So meaning that you need to use a lower pH, okay? And there's rarely any direct comparison between moisturizer. If you ask which moisturizer is better, so but however, those well documented are urea, glycerin, for example, propylene glycol, lactic ceramide, and aluminum hydrochlorate. So this is a urea formula from Eucerin that contains urea, ceramides, which is also a natural moisturizing factor, and glycerin to protect the skin. So it can be considered a good moisturizer. So it has shown that, so if you use it, it can help to reduce, the reduction in 91% in severe dryness. All right. Okay, so So this is actually one of my patients. This is probably my last slide. So they have a very dry skin, a bit irritated. Okay. So this is another photo. All right. After treatment for only 3 days, it can back to normal. Okay. So you just need to treat, achieve a correct diagnosis and the necessary appropriate treatment. Okay. With that, actually, I thank you for your attention. So, of course, I pray for everyone for the pandemic to be over soon. And I actually like travel and I do miss travel. And with that, I thank you for your attention. Yeah.
Okay, all right. Thank you, Dr. Tan, for the insightful sharing. I also miss traveling. Okay, I have
Okay.
also learned a lot from you, and we hope our audience also learned a lot too. So yes, urea is a humitant, is an important and useful ingredient in a
Yes.
skincare product that could help out of the dry skin relief.
Yeah.
Okay, if you have diabetes or know someone who has diabetes, please share with them the useful tips that Dr. Tan has shared just now. Let me know in the comment section if you enjoy the sharing. All right, before we start with our Q&A sessions, I'm sure a lot of you are waiting for the giveaway. So this question is very easy if you listen to Dr. Tan just now. So answer these questions. Is dry skin a common skin condition in diabetic patients? Yes or no? In the chat box, we will select 10 winners with the most accurate answer randomly to win using 5% wash fluid 400 ml after the sessions. Do remember to like Caring Pharmacy and use sharing Facebook page because we will posting the winners announcement there next week. Okay. So let us go to the Q&A session. So the first question from Miss Lee Xiaolian. People also ask, is there a connection between psoriasis and diabetes? For Dr. Tan?
Yes. The answer is yes. Yeah, there is a connection. If you have psoriasis, then you're more prone to diabetes. In fact, if you have psoriasis, we would like to screen you, do some blood tests, to screen for diabetes.
Oh.
And if you have psoriasis, not only diabetes, you might have a higher risk of getting a heart disease. Okay, so and also you might have a higher risk of getting, hypercholesterolemia or hyperpressure. So this is all, in the same, we can say that you have that, you can higher risk of getting the others. Okay.
Okay, thank you, Dr. Tan, for the explanation. So for the second question for Miss Singi Ku, how to identify dry skin caused by diabetes and no, it is not caused by other reasons?
Yes, so this is the good questions. And in fact, you need to know that whether, first of all, you need to look at the age, okay? At what age you start to have this, dry skin. So if you have it when you're a very young baby, it's probably congenital. But of course, if you have an eczema, sometimes you forget about it, okay? So when you get better, then you probably forget that you have eczema, but the dry skin will last for life. Okay, so then of course you need to know whether you got something, like cancerous, whether you are malnutrition, whether it's caused by hormone problem. So when your age, get catching up, so it's good to do like a screening if you really have dry skin. All right, and also you try to find out, any changes like, for example, loss of weight, loss of appetite. Okay, so whether you have any serious disorders, I would say very difficult to just say in this lecture, but you need to find out probably more regarding your dry skin if you have really dry skin causing you to have problem. Okay.
Okay. Thank you, Dr. Tan. For the third question, from the Miss Liz on. This one I think is very interesting questions. I also want to ask actually, what type of the moisturizer are the best to use for diabetes and how often should we apply per day?
So there's no, from my slide just now, actually I mentioned there's no comparison between individual moisturizer. So I don't have evidence-based, answer for you. But of course, the good moisturizer is those that don't have any fragrance, okay, with a low pH and may contains ceramide, And some of the study has shows that those who contain urea also very good for hydrating your skin. Okay, so then, but it also depends. Sometimes in some of the moisturizer contains some preservative. It might be irritative to your skin as well, because different people respond different to different chemicals. It is individual based. So I would say if you want, you choose the one safer is the one with I would say ointment, so with less preservative. So then you can start with that. Okay, so but among all the moisturizer, I think there are many range in the pharmacy. So I think you can you need to try it on first before you know that whether it's suitable for you or not. Okay.
Okay, thank you for the explanation, Dr. Tan. So for the next question, what is your advice on a patient with diabetic neuropathy? He's not taking any diabetic medicines, but mainly on supplements only. Then the reading, the sugar reading will be between 7 to 12 and it's fluctuate.
Okay.
Okay, controlling diet, but of course, sometimes do eat out, the patients do eat out outside foods. Currently on whole grain meal. So can maybe Dr. Tan can answer this question for this audience?
Actually, this question basically I don't really understand the questions. If you have the diabetic skin disorders or is
neuropathy.
Neuro. It's a
Neuro.
nerve problem.
Yeah.
So I think this patient probably needs to seek a neurologist advice, but not necessary. So diabetic neuropathy, there are a lot of presentation. So it can be just a glove and sensory loss, like you feel numbness over your skin on the palm and so. All right. So then, of course, it is very important, to control your diabetes. And your diabetes control is actually, you can check it through your blood taking, okay, before meal, after meal, 2 hours after meal, and also HbA1c, which actually monitor, an average of 3 months control of your diabetes. So you have to control your diabetes so that the, diabetic neuropathy can improve. And of course, there are medications for it, but of course, you need to, probably check, whether it is really diabetic neuropathy in the first place, and whether you're suitable to start on medication or not to treat the diabetic neuropathy. But of course, if you want to ask about diabetic dermopathy, so probably I'm more a best person to answer the questions. Okay.
Okay. Okay. Okay. Thank you, Dr. Tan, for the explanations.
Yes.
Yeah. So I still, due to the time constraint, I see there's still a lot of questions, but somebody will try to answer the questions. So I think that's the end of the sharing session. So before end our session, Doctor, do you have any other tips or key takeaways that you would like to share?
Of course, if you have a very dry skin, it's a very, very itchy condition. So you need to put moisturizer. And I haven't mentioned that how frequent we need to put. It can be as frequent as every hour. All right? Okay.
Okay,
that's
thank
the
you.
tips. All right.
Thank you, Dr. Tan. Okay.
All right. Thank you.
Thank you.
Introducing the Freestyle Libre system, the world's first.
Hello.
Hi.
Wait, just now the video.
Can you hear me?
Yeah, I can hear you, Dr. Zeti. Hello, Dr. Zeti. I'm Kelvin. Okay. So last but not least, for our last session, today we are having our guest speaker here, Dr. Zeti, who is a consultant family medicine specialist at DTHO Family Clinic. So during this live stream, we will talk about the importance of glucose monitoring, diet and exercise in diabetic management. And if you are a caregiver or family member for someone who has diabetes, we will be sharing about how you can take care of your loved one who has diabetes. Before we dive in, I just want to share some exciting news with you. We have an attractive and exclusive giveaway. 3 lucky winners can stand a chance to walk away with a premium tiffin carrier. So how it works, after the sessions, we will be asking a question. And if you answer correctly, 3 lucky winners will be walking away with a tiffin carrier. So stay with us till the whole live stream. So if you have any questions about glucose monitoring, just key in your question in the Q&A, and Dr. Zeti will answer them for you during the Q&A session. So hi, Dr. Zeti, how are you?
Hi.
Hello.
Can you hear me? Is it clear?
Yeah, I can hear you clearly. Yeah.
Okay.
So, Dr. Zeti, I heard you are also working in the Ministry of Defense. Can I know what is
Yes,
your
I
role
do.
over there?
Sorry?
Can I know what is your role over there? I don't know where is
I'm a doctor, a medical doctor.
Mhm.
So I'm pretty much like other doctors out there. I'm in the primary care side, which is from the clinic base. But the only difference that I'm being paid by the Ministry of Defense instead of Ministry of Health. So the
Okay.
rest are all the same, and I wear uniform.
Okay, cool.
So I'm like double frontliner, you know.
Double frontliner, yeah lah.
Yeah.
Doctor, so our audience here today would like to learn more about the penless glucose monitoring. So, Doctor, maybe we can start with by looking in the current diabetes prevalence in Malaysia.
Okay. So as you can see the slide, okay, since we are already at 9:45, right? Nearly 10. It's almost my bedtime. So I'll be kind to everyone. We won't be having like a talk. We won't be having like a lecture. Instead, we can just like have a chit chat, you know, just to share about this new device that we're talking about. But before that, I want to give some background information to everyone. We all know that diabetes in Malaysia is very how to say very rampant, but we might not realize that it is as common as 1 in 5, you know. So now in the chat room, we have like about 300 participants. Can you believe it that 60 of us is going to die a diabetic? We're going to be a diabetic before we die. Okay, so that is quite a scary statistic. Okay, and 1 in 5 will be diabetic, and the other 4, the other normal 4, 10% of that, 10% of the normal is pre-diabetic. Pre-diabetic meaning that in the next 5 years they will become diabetic. Okay, that is how common diabetes is in Malaysia, in our country now. And this data is from 2019 National Health and Mobility Survey, which is already 2 years ago. So I'm sure now it is more than that. And at that time, 3.5 million people aged 18 years and above are actually diabetic. Okay, and you can see the trend. If you can see, the graph is a bit too small there, but you can see that the trend that is actually going up. Okay, this is not only in our country, it's worldwide. Okay.
Okay, wow, 1 out of 5, which means 60
Yeah, 1 out of 5.
Sounds very scary. As a pharmacist, I do understand that diabetes leads to many complications such as cardiovascular disease, nerve damage, kidney damage, and food ulcerations. However, Dr. Zeti, would you like to share with us what are some struggles that your patients living with diabetes face on daily basis?
Yeah, I'm sure. Just now in the first lecture, we learned a lot about diabetes. So I'm not going to bore everyone about the struggles of diabetes. But since today our talk is about the device, right? We know that there's no way to manage diabetes without monitoring. So we need to monitor. Okay. So that is, I think, the struggle that my diabetic patient have to go through every day. Okay, there's no way to know your glucose level other than to do a blood glucose monitoring, which is to prick your finger and put it into the device, and then we get a reading. So and we have to do it as often as possible. You know, in some diabetic patient who is actually very badly controlled, or especially the one on insulin, they have to do as often as 4 times a day. And in my patient who is pregnant, they have to do as often as 6 or 7 times a day, 7 points glucose monitoring. So can you imagine, like your life is full of pricking yourself, and it's very inconvenient for you to prick yourself, to find a place where it's suitable, you know, to draw the blood, to wash the hand, and then to record. You know, can you imagine doing that day in and day out? But unfortunately, there's no way, no other way to not do that, because we really need the reading to know how we are going to manage this patient, even for the doctors and also for the patient themselves. So that is, to me, is the main struggle. And as you know now, due to our current pandemic situation, we we kind of like reduce the visit to see the doctor. Okay, maybe it's because of the restriction orders, or maybe some patient might feel uncomfortable to visit the clinic because they are afraid of the risk of getting COVID. So they tend to maybe not visit the clinic as often. So that put the responsibility back to them to monitor their own sugar. So because of that, they need to monitor on their own, because they need to monitor themselves more since they are not visiting the doctor. If not, the doctor will be doing the blood test, right? But now, because they are staying at home, so they have to take charge to monitor their sugar more frequently. So that itself is already a struggle. I mean, you haven't and then there's also the struggle of like choosing your food, and you know, titrating your medication, titrating your insulins. But the main is to monitor the sugar. That's what I'm going to talk about today.
Yeah, I totally understand. It's like I can't imagine I exchange for my favorite food like Sarawak Sa, nasi lemak, or durian anymore. By the way, Dr. Zeti, do you like durian?
No, I don't.
Okay.
I'm a bit Mak Saleh, you know, I don't like durian.
Okay. So,
but I do like chocolate.
Oh, chocolate, huh? Okay, chocolate.
And nasi
I
lemak
also
and teh
like
tarik.
chocolate. Okay, it's very stressful for the people with diabetes, and they need to exchange the food. Okay, so talking about this, would you like to share some tips or guidance for diet and lifestyle modifications? Because I heard from the public that the people with the diabetes cannot eat carbohydrates. Is this true, doctor?
Okay. So as I said, it is not about which food to eat. Okay, it's more about which food spike your sugar. Okay, which food spike your sugar. But as a general rule, we know, what we hear from the first lecture just now. Okay, we know that sugar and carbohydrates will increase our blood glucose, which is our blood sugar. Okay, if we eat food that is sweet or food that come from the carbohydrate group, we know that food will increase the sugar, but we don't know how much. Okay, because different people have different reaction toward this food. Okay, as you can see, the carbohydrate, there's so many food under this carbohydrate group: cereal and grains, starchy vegetable and legumes, fruits, even the healthy fruits and the healthy milk and dairy products. Okay, they are considered healthy food, but they still contain sugar. Okay, and in diabetic patient, they might not be able to tolerate the sugar. Okay, so ideally, if you are a diabetic patient and if you can avoid all this food, then problem is solved. We don't even have to talk about monitoring. Okay, we can, orang kata tutup kedai lah, tutup kedai. Okay, if all of us cannot eat rice, don't eat bread, don't eat fruits, don't drink milk, don't eat anything sweet, avoid all your potatoes, fries, okay, then okay, problem solved. My problem solved, your problem solved. Okay, but the problem is we can't. Okay, at least I can't. Okay, so since we cannot avoid all these carbohydrates, that's why we need monitoring, because we need to know how much we can eat but still not so detrimental to our body. And that is very personal to every individual, because it depends on how you eat that carbohydrate. Okay, your body respond, and the body response also is being influenced by many things. If it is influenced by the type, like how you eat. Like if you eat rice, how you eat your rice. Is it you eat your rice buat kuih lah as a pulut ke, or you eat your rice with good proteins and lots of vegetables. Okay, and how much you eat your rice? How much is it? Like, is it a lot? Some people eat 2 pinggan, or you can eat like a quarter. Okay, and what is your activity? Some people, they are very active. They eat we can eat, like Calvin, you can eat the same amount of rice with me, but our reaction will be totally different. So there's so much variable that is influencing this the sugar, that this to give advice like to reduce this is too generalized. Like if when I tell my patient, can you please reduce your carbohydrate, they will ask, how much, doctor? How much rice can I eat? The answer is actually I don't know, because I will only know after you monitor your sugar. So you eat, before you eat your rice, you will check your sugar, and then you eat the rice, and then within 1 or 2 hours you repeat the blood test, and we will see how much spike is in your sugar. Then I will tell you that whether the rice is okay for you. Okay, so it depends on a lot of other factors. That's why monitoring is very, very important. Okay, it's not a simple answer. If it's as simple as that, life will be so much easier. Okay.
Okay, I totally understand. The glucose monitoring is very important. But just now you mentioned if like need to keep pricking 7 pricks or 4 pricks, or if like especially if someone working in the F&B, maybe it's very difficult for them, because after pricking you still need to use the hand sanitizer. Wow, very painful.
Yeah.
For me, just a paper cut after I apply the hand sanitizer, it was very painful. So maybe doctor, do you mind to share with the portion size? Maybe you can tell the audience about the portion size at least. Like
I said just now, is you have to personalize the food according to how much your body can tolerate. Okay, so I give an example of this My Healthy Plate, which is a concept recommended by our Ministry of Health. We call it Malaysian Healthy Plate. Okay, so Ministry of Health do this Malaysian Healthy Plate, especially for Malaysian people. Okay, that's why you can see rice and banana in the plate. Okay, because banana is like Malaysian fruit, and rice is like Malaysian food also. It's a universal Malaysian food. Okay, if you see healthy plate in America, the food inside there will be different. Okay, so our healthy plate will have this rice and banana, but that doesn't mean that for us to be healthy we need to eat rice and banana. A lot of people, they misunderstood this. Okay, this is to show that we Malaysian, we need to portion our food. Meaning, and this is for healthy people, not only for diabetes only, okay? This is for general people. So even for us who don't have diabetes, okay, you're not supposed to eat 1 full plate of rice every day. If you eat 1 full plate of rice every day, soon you're gonna be not well too. Okay, we just don't know when. Okay, so what it's trying to do is you need to portion your carb. Okay, you need to portion your carb. But if you are a diabetic, can you use this portion? Okay, you need to tailor it to your own body. How to do it is, okay, say you have a quarter of rice, and say you eat your lunch exactly like the one in the Malaysian Healthy Plate: a banana, vegetables, a quarter of rice, and also a fish dish. Okay, exactly like that. Suku separuh, quarter half. Then you check your sugar before is about maybe 6, and then you check your sugar after, it should be around 8. The increase should be like not more than 2. Okay, but when you check, you're so horrified to find that actually your sugar is 10, which is it increased by 4 units. Okay, 4 unit means it's too much already. It's too much already. So you need to reduce your carb, because we know that your source of sugar is the carbohydrate. Okay, so you need to reduce the carb. So you look at the plate, what are the carbohydrate that might be the culprit, that might be the possible source of sugar in this meal? So it is the rice and the banana. So you have to choose. You want to eat rice or you want to eat banana? You can choose only one. Because having two of that spike your sugar too much. So maybe like in my case, because I love rice and I don't like banana, I will choose rice. So in my next meal, I'm going to eat again the same meal but without the banana. So for the bananas portion, I will replace with vegetables, or I will replace with more fish. Instead of eating one fish, I will eat two fishes instead. Because if not, I'll be hungry, right? If I keep on reducing, I'll be hungry. So I eat two fish and a quarter of rice and vegetables, and I'll repeat the test again. Before, if I can get 6, and after, if I can get 8 or below, then the portion is okay for me. But if it's still high, I still have to further think of how I can reduce my portion. Okay, that is just about the rice portion. I have a patient who can only tolerate 2 tablespoons of rice. She said that if she eat more than 2 tablespoons of rice, her sugar will spike too high. Yeah, so she actually eat 2 tablespoons, but at least she knows. So she know how to control her sugar. Okay. Okay, if even you already reduced the rice and you already not eating fruits, but still your sugar is still high, okay, you have to look further. Maybe the fish has too much sauces. Okay, so you have to change. Okay, you don't cook a fish in, try to choose dishes like dishes that don't have sauce. You know, diabetic is not good to eat things like soy sauce fish or sweet sour, you know, that kind of dishes. You should choose dishes like fried fish, or what do you call it, ikan bakar, or curry, even curry or masak lemak. Okay, those food, they don't have sauces, so the likelihood to have sugar in it, it will be lower. Okay, so a lot. And then you can also, apart than tweaking the way you cook, you can also tweak your behavior. Okay, if you had a good meal, like for example, like I don't really eat much, but today Kelvin is gonna belanja me what are you gonna belanja me, Kelvin?
Maybe I belanja you.
Maybe nasi lemak lah.
Can.
Nasi lemak. So because somebody is gonna belanja me, so of course I'm gonna eat a lot, right? So but after I eat, I felt guilty because my sugar, I know my sugar is gonna spike. So I can do some exercise right after that. Okay, I can go for a like 30-minute walks, and that will also help to flatten my sugar. It will help the spike not to be too high, because my muscle will be taking in the sugar as an energy. Okay, so these are just the example of how you can tweak your behavior, your lifestyle, so that you can have a better control of your sugar. But there's no way for you to do all this if you don't monitor. At the end of the day, you need to monitor either by pricking or some other ways. You still need to monitor.
Okay, so from Dr. Zeti, the suku separat just a guideline for you. The most important is you need to do the glucose monitoring, either by pricking your fingers or CGM, continuous glucose monitoring. So just now we mentioned we need to prick the fingers, right? So anyone of you relate to these difficulties, you can type in the comment box. Okay, while we generate some comments in the chat, please feel free to ask any questions you may have as well in the Q&A box. We will be addressing them towards the end of our live stream, so still stay on. Okay, while you guys are leaving comments in the chat, here's our first hand from Mr. Kevin Tan, who is living with type 2 diabetes and have been using CGM. And how it changed his life. Okay, let's see this video.
I was first diagnosed with diabetes last year, Of course, it came as a shock because I'm fairly athletic. I really hate the idea of injections and pricking. That's why I quickly went about to find a solution, and it was Abbott Freestyle Libre device. I could be doing my sport, cycling, and I can just take my sugar level check on the go. Readouts were continuous, which means that from a data angle, I could see the impact of certain foods I take or certain exercise that I do on a more regular basis. The Freestyle Libre is a leap forward from the finger pricking method.
Wow, that was really inspiring. Diabetes is a very real and prevalent condition that can happen anyone. I imagine it can be quite daunting at first, right? But from the Kevin stories, we see that diabetes can be managed. Life doesn't need to take a pause because of the diabetes. It's still possible to live an active and healthy life. Now I'm eager to find out more about this CGM. And I see the Dr. Zeti, are you wearing the sensor right now on your arm right now?
Yeah.
Okay.
Here, I don't know whether you can see it.
Okay, yeah. After you press it,
It's like the 50 minutes coin.
Yeah.
Coin. Yeah, I'm too shy to show it on my skin.
Okay, so maybe do you mind to demonstrate how to use the CGM, the Freestyle River?
Okay. So basically, but we haven't had the video yet, right? Later, are we going to have the video?
I think later we can show the video.
Okay. So basically, as I said just now, the conventional way is when you prick the sugar. Okay. So there's this new technology where we call it a CGM, continuous glucose monitoring. So just like the name state, continuous. So it is continuously monitoring your glucose, continuously, 24 hours a day, 14 days, for 14 days. Okay. So this system consists of two parts. Okay. One is the sensor, which the one that I'm wearing here, the sensor. Okay. And the other one is the reader. Okay. It's the reader. So what you need to do is you need to install the sensor and wear it on your arms. Usually this is my favorite place because it is, it won't knock on my handbag or something like that. Okay. And then for you to check your sugar, you just need to scan it. You just need to scan it like this. And then you get your reading. Okay. Where is it?
Do you mind to share the reading? Yeah.
It's reflective, I cannot see.
Maybe you can tell me your reading. 5 point something.
My reading is 5.2.
Wow, very nice reading.
I don't know, it's reflective. Right? You cannot see the. Can you see?
Yeah, roughly. I can see
I
the
think
5.
it's too bright. Wait, can you see? Yeah, I cannot see because it's reflective.
Okay, it's okay. I can see the
5.2.
5.2. I can see.
I'm not lying, okay?
Okay. The machine just doesn't lie.
It's actually lower, but I just eat a chocolate.
Okay.
Okay. So it's very easy. You can even do it like on top of your baju. You don't need to, like usually I just do it and nobody even notice. Okay, it's very easy. So the sensor will store, even though when you're not scanning, the sensor will store will continue to monitor, continue to check your sugar and will collect the data in the sensor over here for 8 hours. Okay. When you scan, you are actually transferring the data to your reader. Then it can be kept to your reader. So when you want to review, you can get like a whole set of data like this lah.
Doctor, do you mind?
You cannot see lah. That's the thing.
I think yeah.
Never mind, later we see the video.
Later we
cannot see.
Yeah, can. Later we show the video.
Okay. So you can see the graph. You can see all your records here. It will be kept in this reader for 3 months. So it's very easy, right? You don't need to take out your lancet. You don't need to wash your hand. You don't need to prick and then get a tissue and then wipe and then wait and then jot down the values. Even you can see the graph of the day, like how your day is like. Okay. And that is the most that is the most beautiful things about CGM. Okay, because if you take the sugar, if you do the pinprick, right, the glucometer pinprick, you are actually measuring the sugar like as a snapshot, you know, as like one shot only, that sugar at that particular time. Okay, so it's just like you take a picture lah. Okay, but when you have a CGM, because you can see how the sugar rise, at what point it peaks and how it come down, and you can see the variation towards the day, the variation to your diurnal rhythm, which is to in the day and the time. Okay, it is like a video, you know. It's like you're looking at a video. It's very dynamic. Okay, so it gives us a lot of information that you cannot get by just pricking. It's a lot of information. For example, like you know what is the peak of every food. Okay, you know what, because if you do a pinprick, okay, sometimes you prick you do a pinprick before the food, and then you do the pinprick maybe at 2 hours, but maybe your food already peaked at 1 hour, so you miss the peak. So by the time 2 hours you check, hey, my sugar is good, but actually you already missed the peak. It has peaked before that. Okay, you miss. But if you are using continuous glucose monitoring, you will see the graph, so you won't ever miss the peak, even if you don't scan at that point. Okay, and after 14 days, you can bring this, you can put it into your laptop. There's a software. It will generate like a report, all the 14 days report, so you can you can print it, and you can, you know, have a hard copy to look at it. Like some people, they don't like to see, you know, like this is too small, right? Like you sometimes macam tak puas lah, and you cannot see it well. Okay, and you can bring it to your doctor, and this will be a very helpful tools for the doctor to titrate your medication, especially if you're insulin. So we know at what point that we should increase your insulin, at what point we should decrease your insulin, because we have a lot of undiagnosed hypo, you know, like you are having hypo, but we don't know, because when you come to see the doctor in the morning, the sugar is high, but at home your sugar is low. So when you see a doctor in the morning, the sugar is high, the doctor have the tendency to increase the dose, but actually you're having a lot of hypo. Okay, and when you're having a lot of hypo, not everyone that have hypo actually have all the symptoms. You know, sometimes they just tend to eat more. They cannot control their craving. So when they come to see a doctor, and doctor will scold them, hey, why you eat this, why you eat that? Actually they're having a hypo. Okay, so with this it solves the problem. It gives us more
data.
More data and more insight into what is happening. Okay, that is only for diabetes, but I'm also using this for wellness. Like for me, I'm not diabetic, but why am I wearing this? A lot of people say, why you waste your money to wear this? You're not even diabetic. And this one not sponsored by Abbott, you know, I pay on my own, by the way.
Maybe later the Abbott will sponsor you after this.
Yeah. After this one to sponsor, okay, I terima, tapi I'm not. This one is I pay on my own. So basically, I wear it because I want to monitor my food, so that I can have a better insight into the food choices that I make, so I can make a better food choices. Okay, so that if I can control my sugar now, and I know what food that have minimal impact on my glucose variation, so I hope that I'm gonna stay healthier longer, and maybe get diabetes later. So maybe if I'm lucky, if I get diabetes at 98 years old and I die at 96 years old, I don't get diabetes, right? That's what I'm trying to do. So even if you learn about longevity, right? If you learn about wellness, okay, one of the parameters of longevity, wellness, or what we call anti-aging, right? Now people always talk about prevention, anti-aging. Okay, one of the pillars is actually metabolic health, which is you have to make sure that your glucose is in a good range. Okay, even for fitness, even for like athletes. So there's a lot of athletes who are wearing this because they want to make sure whenever they exercise, they don't go too low, and also they don't go too high. Okay, because stress can also increase the sugar.
Okay.
Yeah. Okay.
Oh, doctor, okay, thank you for your sharing, yeah, doctor. So can I wonder, maybe some people will want to see how fast we can apply the sensor. Maybe we can now see the video.
Okay.
How fast we can apply the sensor? Yeah. Wow, that was really, really quick. I think less than 10 seconds, I like pop. The sensor.
Actually, most of my patients wear it by themselves, Only the
okay.
first time I will install for them. After that, they are confident to wear it by themselves. It's very easy.
Oh, okay. So just now you mentioned when the athlete can wear it also. So is it water resistant?
Yeah. It's water
Okay.
resistant. You can use it in the swimming pool, in
Oh.
the sauna. Yeah.
Okay.
It's just
Okay.
sticks there for the next 14 days. Yeah.
Okay, very nice. So for all you gym rats out there, you can continue exercise without having the step to prick your fingers already.
Yeah, because diabetes patients sometimes they are worried, right? When they're exercising, they're worried. Like just now we hear the first lecture, he did mention that you can go into hypo, right? So like this is where it's easier for them to know like how far, I mean like at what level they can go when they jog or when they do some activities. They know how to tailor their exercise.
Okay. Thank you, Dr. Zeti. So how is CGM different from the traditional finger pricking beside of the like you need to pop a lot lah? You need to pop your finger a lot. Do you mind to explain more?
Yeah. Like I said just now, CGM is like it's like a picture, as I said just now, right? CGM is like a picture. You can only see. Glucometer, a finger prick, is like a picture. You can only see at that point. Okay. Whereas CGM is like a video. You see how the sugar rise and then how the sugar goes down. So when you are seeing it coming down, so if your sugar, like just now my sugar is 5, my sugar is 5, okay, but if I'm a diabetic patient and my sugar is 5 and I'm not going to have dinner after this, and after this I'm going to inject my insulin, so I know it's going to be lower, right? So it's different that my sugar is 5 but it's in the outgoing trend, because in the CGM you can also see the movement of the sugar. There will be arrows, to indicate whether the sugar is 5 but going up or the value is 5 but going down. Okay. So if you just do a glucometer, you don't know about, you have no idea. You know that it's 5 can be 5 going down or 5 going up, isn't it? So it really change your management. If okay, how about 4? Like diabetes, we usually say we use the level, anything lower than 4 is hypo. So if your sugar is 4 but it's going up, you don't have to take the sweet, even though if your insulin, because you know that it's going up. But if your sugar is 4 but it's going down, okay, you have to take something sweet. If you already take your insulin, you need to take something sweet, because you know the insulin is going to take its effect. You know after this it's going to go down even further. So by having this CGM, you won't like taking sweet unnecessarily, because sometimes people, they are not even hypo, but they keep on taking sweet because they feel hypo, or they look at the levels lower. They are panicking because hypo is actually a very horrible experience. So whenever a diabetic patient, when the sugar start to goes down, they already worried because they don't want to go into hypo. It's a horrible feeling. You feel like you're gonna die. You like sweating. You feel like you're gonna faint. You feel like macam like you're having a panic attack. Yeah. So they will do anything. The moment their sugar start to goes down, they will start to the tendency to take sweet or food is higher. So when you have this monitoring, it gives you like you feel safe because you know that because you keep on checking, you can continue keep on checking, keep on scanning especially when your reading is low, you will keep on continue to check until the reading starts to go up again. Same goes is for if you are caring for patient with diabetes. Imagine your mother, your elderly parents with diabetes, okay, and then you see them you always worried, right? If they go into hypo, you need to send them to hospital. Okay, so if you have this device, it's easier for you to scan. You just scan them, so you know. And this is very, very helpful at the time when we titrating the insulin at the initial part, when we want to, because we don't know yet what is the correct level of insulin that the patient needs. So at the initial phase, it is very helpful to have a CGM so that we know what is the optimum
Insulin dose for the
yeah.
Okay.
Yeah.
Perhaps, doctor, do you mind to share the lifestyle changes for the diabetic patients, like the modification? What can they do beside the glucose monitoring?
Okay, can we see the last slide? Okay, so I mean there's a lot more, but I give you the top 5 lah, because it's already more than 10 o'clock. Nanti kalau bagi more than 5, very hard to remember, right?
Yeah,
Okay.
true.
So of course, number 1 is avoid, or if you cannot avoid, reduce sugary food and drinks. Okay, sugar is bad for everyone, not only for diabetes, for everyone. Everyone also shouldn't be eating sugar every day, even though you don't have diabetes. Okay, you can have sugar once in a while when celebrating birthdays or things like that, but you shouldn't be having sugar every day. Try, if you are actually taking sugar every day now, slowly try to reduce it, especially if you're a diabetic patient. Try your best to avoid it once and for all. Okay, I know it's painful. Okay, I know it's painful. It's been hard for all of us, not only for diabetic only. Okay, but just think of it like this. Our tongue, we just need 3 weeks to remodel, to change our tongue. If you don't drink sweet drink for 3 weeks, after that it's going to be easier, because only 3 you're going to feel tak sedap, you feel miserable only for the first 3 weeks. Okay, after that you will feel okay. Okay, then number 2, reduce carbohydrate. Okay, even the healthy carbohydrate like fruits and rice and potatoes, they are healthy, and milk, they are healthy carbohydrate, but still you have to reduce it. Okay, because they have sugar. The moment carbohydrate gets into your body, it turns into sugar. So it's just the same for diabetic patient. Carbohydrate, when they go into body, it just as the same as sugar. So there's no point that you don't eat rice and you eat bread. It's the same thing. And you don't eat rice and you eat oats. It's the same thing. Okay, all are carbohydrates. Okay. Number 3, increase fiber intake. Okay, why you increase the fiber intake? Because when you eat your rice with, say, fiber, with say vegetables, okay, it slows down the absorption of the sugar, the glucose. Okay, so the spike wouldn't be so bad. Okay, so if you eat lots of fiber, your carbohydrate, your sugar spike wouldn't be so bad. Okay. Okay, number 4, read the food labels, because you need to know what is getting into your body. Okay, at first it might seem overwhelming because you don't understand what is written there, but if you keep on reading, you will realize there's so much sugar in our food, especially the one that come in packaging, processed food. Anything that come in package, please read the food labels. Okay, that's why as far as possible, try to eat the food that you cook yourself at home, because you know what's inside it. Okay, and number 5, increase physical activity. Okay, increase physical activity doesn't mean that you need to run, doesn't mean that you need to do tabata or do HIIT or weight. It's not that. It's just keep moving. That's all. As I said just now, after your food, after your lunch, if you just go for a 30 minutes walk, it will really help with your flattening your sugar curve. Okay, so we want to flatten the curve lah, just like COVID. flatten the curve.
Okay, thank you, Doctor. This is very insightful sharing. So as for the Doctor sharing, we need to try to reduce the sugary foods and reduce the carbohydrates and increase the fiber intake and always read the food labels. So sometimes they will say no added sugar, but you still need to turn behind to see any sugar content because sometimes the things will contain the sugar, but they not added any sugar.
Yeah, sure.
Okay.
Usually the no added sugar is the one with lots of sugar.
Marketing strategy. Okay, so and the last one is the increased physical activity. So not necessary you need to like run or anything. Maybe you can walk by the walking stick if your joint is okay. And then on just now, Mr. Kelvin also sharing, stand more also will help to reduce the glucose. So I'm sure everyone that joined us tonight managed to learn a thing or two about the importance of our food intake and regular exercise, especially for those who are living with diabetes. All this can be possible with CGM. Before we end, I'm sure you're all waiting for the giveaway, right? Okay, so here is the questions. So answer these questions. Freestyle liver system is clinically proven to be accurate, stable, and consistent up to 14 days without the need for finger pricking calibrations. Is this true or false? We will select 3 winners with the correct answer randomly to win a premium TV carrier after the sessions. Do remember to like our Caring Facebook page because we are posting the winners announcement there next week. Okay, so thank you, Dr. Zeti, again. And we also want to thank you about Diabetes Care for these sessions, for enabling everyone, including myself, to understand more about the importance of managing the disease and how we can support those around with us to help with the CGM, with the help with the CGM. Okay, Dr. Zeti, thank you again. Thank you for your time and company. I think it's time for you to...
We still have 266 participants, very good.
Very good.
Still awake.
I think you're very tired already, right? You already see your sleeping time already. Okay.
Thank you.
Okay, so before we end, we still need to have our Q&A sessions. So let me see our first question. Wait, let me see the question first. Okay. Also, so I think some... Okay. Wait,
I cannot hear you.
Sorry, just now I'm reading the questions. Okay, the first one from the Mr. Raja, is the CGM installation painful? So maybe Dr. Zeti can answer this question. Just
most of the time it's not painful, but sometimes you kind of like hit the nerve. It might be like a bit stingy, but just a little bit lah. I don't have a patient cry over it yet. But most of the time patient will say, "Hey, doctor, tak rasa apa-apa lah."
Okay, that is good to know that. Yeah, because I also scared for the pen. Even though I help people to do the finger pricking, but I scared for the needles. Okay,
it's very small. The needle is very small.
Okay.
It's actually smaller than the needle that we use to prick the blood. Yeah, smaller than that.
Okay.
The needle is just used to put in the filament into your cell. That's all.
Okay.
After that, we take out the needle. The filament will still stay inside your cell.
Okay. So for the next question will be, is this CGM same like doing a HbA1c test? Maybe doctor can answer.
Okay. Actually, it's not the same because the HbA1c is like your average for 3 months. But within that 2 weeks, they have a formula that they can like predict like what is your HbA1c like. From your 2 weeks reading, okay, they give like a reading. They can predict your HbA1c. but it's not the same as HbA1c. HbA1c is when you take your venous blood, okay, and then you send it to the lab, and the lab will give you the average of your sugar for the past 3 months, okay. Whereas this device, it collects all your sugar reading in your cell, okay, in your intracellular glucose levels, and then they use a formula to predict what is your HbA1c. So yes, you do have a result that predict your HbA1c, provided that in the 2 weeks you behave exactly like that for the next 3 months lah. If you just be a good girl or a good boy for that 2 weeks, and then after that you are naughty, of course you won't get the prediction will be wrong, isn't it? If you eat the same thing in that 2 weeks, for the next 3 months you get the same level as your HbA1c. Yeah.
Okay, thank you, Dr. Zeti, for the clear explanations. So for our today last questions, this one is very interesting questions. For Muslim, if you wear the device for CGM, how do you perform mandi wajib since water won't go through the part where the device is applied? So this one is the one of the audience asked lah. Maybe
Yeah,
Dr. Zeti.
that's a very relevant question. Actually, a lot of my patient ask that. Okay, I'm not the ustazah to answer that. But I take it as, because this is very important. Checking blood sugar for diabetes patient, even for non-diabetic patients, so it's very important. So it's just like a plaster, you know, when we have when we don't wear CGM just for fun, you know, we wear it for our health and for a reason. Okay, so if you have like a plaster over your body also, your water can also cannot reach the skin, okay, but it is allowed in our religion because there's a need for it, okay. So from my understanding, it's just like when you do an operation or you wear a cast, right? So you it is allowed, okay. That's from my understanding. But of course, if you want to get a better explanation, you have to ask the ustazah lah. Of course, I'm not the ustazah.
Okay.
But the concept is similar. Okay.
Okay, thank you for your explanation. So yeah, Doctor, still one more question, and this one is also very interesting. From Miss Lee's on, what is the acceptance variance in reading between the liver and the finger pricking test? Overall, the liver will produce lower readings due to the different type of blood being tested. Maybe, Doctor, can you explain these questions?
Sorry, can you please repeat the question?
Okay, so what is the acceptable variance between in the reading between the liver, the freestyle liver, and
the CGM? Okay.
And the normal traditional blood glucose monitoring? And
Okay.
then overall, is the liver will produce lower reading due to the different types of blood being tested?
Okay.
Okay.
Okay. First, we have to be clear that the CGM is measuring the intracellular glucose, the glucose in the cell. Okay. Whereas the glucometer is measuring the glucose in your blood. So actually, you are measuring two different things. Okay. One is like, it's like you measure the temperature in the room and you measure the temperature outside the room. Okay, it's two different things. But we are not interested in the value, okay, because if we want to diagnose someone with diabetes, we still have to do a blood test. We are not interested with the value. What we are interested with is the trend. The trend means like how high the sugar peak, when the sugar peak, when the sugar goes too low. Okay, that is what we want to know. We are interested in the trend. So it doesn't matter, say, even if I wear it on the left side or on the right side, it will be different, because my muscle because I'm a right-hander, so my muscle on the right will use more sugar, right? So my reading on the right is usually higher. Okay, so the absolute number we don't have to care so much. What we need to see is the rise, the rise and the how long it normalizes. Okay, so because we want our sugar to be as flat as possible. We don't, the variation that's going to make our organs work harder, and it's going to create all these disease like hypertension, diabetes, all is the variation. Even in diabetic patient, the variation like going up and down, going up and down, going up and down, Okay, that is the thing that is actually harmful for us.
Oh.
It's not the for the absolute value. No choice. You have to take blood. Like you go to the clinic and then they poke you at your vein, and you have to use that.
Okay, thank you, Dr. Zeti, for this insightful sharing. I think that is end of the sharing. So before we end our session, Doctor, do you have any tips or key takeaway that you would like to share to our audience?
Tips
Or key takeaways, like maybe like just now. Anything?
What as I said, I don't think we can manage diabetes without monitoring.
Monitoring. So
Whether you're a doctor, you cannot manage your patient without monitoring. You won't be a good doctor. And if you're a patient, you cannot manage your life without monitoring. You won't be a good patient. Yeah, I think that's very clear lah.
Okay.
How you want to monitor is up to you. You want to use glucometer. If you want an easier life, you use CGM.
Okay. Okay. Thank you, Doctor, for the sharing. Okay. So to our audience listen now, don't leave this webinar yet because I will be announcing something special for you guys. Okay. Thank you, Dr. Zeti, for your sharing. Goodbye and see you again. And then good night. Have a nice rest.
Good night.
Good night. Okay. So, okay. Okay, thank you everyone. That is the end of all the 3 sessions that we have today. Now I will be sharing the John Kurang webinar giveaway questions for all the audience. But before that, I think I still got one question. Is the Freestyle River got the giveaway, right? Just now forgot already. Sorry about that. So right now we are having the Freestyle River giveaway sessions. So, wait, just now already. Okay. Right now, actually, Usery actually got the in-store promotion and online promotions. You can get 5 ringgit off with the purchase of 80 ringgit worth of Usery Urea Repair Plus range. So you can visit to our nearby carry store to look for this promotion. And moreover, ours right now also got the coupon marathons. You can look for it for these promotions. Okay. Is our last session. Right now we are giving the questions. This one, John Kurang giveaway. So the first question, the one question is, when is World Diabetes Day 2021? Type your answer in the comment box so we can see the winners. Okay, so wow, a lot of people answer already. So wait, I cannot see. Wait. Oh, hold on for a while. Let me see for the winners. Yeah. I think I already got the winners already. Give me a moment. Yeah. Okay, so I already found the winners. So the first winner will be Intan TJ. The second winner will be Liz On. And then the last winner will be Ted Xiong On. So we actually will send an email for you. So we need to receive your details. So we can send this Lumina 3 tiles glass food container. Okay. So right now, just now I also mentioned you can entitled to get 500 carry points for all the attendees. So maybe right now you can scan the QR code or you can click the link. This link will send you to the Google form. So you just fill in the Google form by tonight, 11:59 p.m. so you can receive the reward. Okay, I think that's for tonight. Thank you everybody for joining us. Okay, good night. Bye-bye. See you again for next webinar.
Introducing the Freestyle Libre system, the world's first flash glucose monitoring system. What can you do with it? You can get a glucose reading with a quick, painless scan without pricking your finger. With a 14-day sensor that you wear on the back of your upper arm and a pocket-sized reader, you can check your glucose anytime, anywhere. Discreetly, as often as you like. The Freestyle Libre system. Why prick when you can scan? When you have to stop to check your blood glucose the old way by pricking your finger, life gets interrupted. And you only get a glucose number and nothing more. A snapshot that tells you where you are, but not where you're going. Starting today, there's a revolutionary way to check your glucose with a quick scan and without the pain, hassles and interruptions of routine finger pricks. All the while giving you more information about your glucose levels than ever before. The Freestyle Libre Flash Glucose Monitoring System. Why prick when you can scan?
Jom kurang manis.
Jom kurang manis. Jom kurang manis.
Jom kurang manis.
Jom kurang manis. Jom kurang manis.
Jom kurang manis.
Jom kurang manis. Jom kurang